home. These are very complex cases, ones that have so many fascinating stories behind them that we actually are capturing it through a docuseries called Ernest Medicine. And we are a nonprofit, and funding for that goes to support the docuseries. And in fact, some of that docuseries we hope to take to Turkey when the time is right.
Thank you. We can continue with Dr. Zishan.
Thank you and good morning. And it's truly a pleasure to be on this video and on this talk and amongst such accomplished individuals. So as you heard, I started my medical journey as a student in Turkey. I went to Hacı Tıp Eg, got my medical degree there, and then got into an international scholars track program at University of Pittsburgh that aspires to create academics and leaders in academic education. And then after that, I was recruited to Hopkins in a hospital medicine division, which wasn't quite a division back then, and we built it. And so it's when we started, at least, it was a new specialty or a new type of general internal medicine that was hospital focused. And as I built my career there, I'm an educator that built a program for underserved students in India who actually pre-medical students to get them into medical school and then mentor them through that from a part of India where the percentage of people even aspiring to go into medical school was abysmal. And along the way, I've built a research career in patient experience and more recently COVID-related, especially related to monoclonal treatment and COVID testing. And along the way, I've transitioned, besides being an educator, I've added some administrative and leadership roles. I was a chief medical officer at a COVID hospital in Baltimore area that ran for 3 years, and now I serve as a senior physician advisor. And the way I put these three roles together is I'm primarily an educator and a mentor for young individuals. And these two other things that I do are fascinating and great, and I enjoy them a lot, but they actually just feed into this other role where I potentially try and be an example for young individuals and allow them to have career path in those directions should they choose. But most often, they go in multiple different directions. And Turkey is another place that I'm very passionate about. I come and I give talks a couple of times every year. I have mentees from Turkey, and being on a forum like this is just amazing if I can connect to more and if it allows for people to connect and move ahead in their career.
Great. Sorry. Thank you. Dr. Furkan.
Hello, everyone. It's great to be here. So my story, I was born in UK and then grew up in Turkey and went to medical school in Kocaeli, which was a great experience. And then during my medical school, I came to US first time in second year of medical school, and I worked with Aziz Sancar. At that time, I kind of being introduced to basic science, and then I would call it this magical world, and then decided to be a physician scientist, both in basic science and clinical sciences. And then after that, right after graduation, I came to US as a postdoctoral research fellow at Harvard in molecular metabolism, and I spent 3 years purely in basic science education. And then when I find myself doing CPR to a mouse, then decided, okay, it's time to go back. And then I applied and did my internal medicine residency again at Harvard. After that, I did endocrinology fellowship another 3 years. In this both medicine residency and endocrinology fellowship, I created kind of my own program that I always continued in the lab in the same time. And after that, I stayed as a faculty at Harvard. And now I would consider myself as a physician scientist. So I would say I'm doing 75% research, which some is still in the lab. We're working on obesity, try to understand what is changing and try to develop some drugs. And then I have another independent research group at Harvard Medical School that we are translating our findings and currently doing a clinical trial. And then I have a very focused clinic on obesity and immunometabolism in the hospital. So I have 1 day a week of a clinic. But COVID changed everything, as for all of us. I was redeployed to COVID service. And kind of regain all of my holistic medicine approach. So I continue as 1 full day of a hospital medicine. Now I continue. I really enjoy being internist in that role and still keep that practice too. So that's me.
Thank you so much for your sharing stories, for the introduction. I want to go back to introduction part because I forgot to open the recording. So it's a little introduction again. Herkese tekrar merhabalar. Bugün tıp eğitimini konuşacağız. Amerika'da ve Türkiye'de sağlık sunumu ve araştırma imkanlarından bahsedeceğiz. Hem Türkiye deneyimi hem Amerika deneyimi olan değerli konuklarımızla bir aradayız. Biraz önce kendilerini tanıttılar. Johns Hopkins'ten Dr. Zishan ve Dr. Ernest ile birlikteyiz. Harvard'dan Dr. Furkan Bey bizimle. Hikayelerini biraz önce kendileri paylaştılar. Dr. Zishan Bey Hacettepe Üniversitesi mezunu. Johns Hopkins Üniversitesi'nde İç Hastalıkları öğretim üyesi ve araştırmacı. Aynı zamanda kendisinin de belirttiği gibi tıp öğrencilerine, tıp okumak isteyen öğrencilere ve tıp öğrencilere mentörlük de yapıyor. Özellikle Hindistan'daki belli kuruluşlarda ama Türk öğrencilerine de çok destek veriyor sağ olsun. Doktor Furkan Bey Koçak Üniversitesi mezunu ve Harvard'da moleküler metabolizma üzerine araştırmalar yapıyor. Biraz önce de kendisi hikayesini paylaşmış oldu. Dr. Ernest de ABD'deki sigorta ve sağlık hizmet sunumundaki sıkıntıları ortaya koyan bir takım çekimler yapıyor, çalışmalar yapıyor ve farklı bir tür sağlık hizmet sunumu da yapıyor. Birazdan ayrıntılarını da paylaşacağız. Ve İngilizce devam edeceğiz yine toplantımıza. So I want to start with Dr. Zishan and Dr. Furkan again. How was your experience in medical school in Turkey? What do you miss the most?
I'll let Furkan go first. Go ahead.
Okay. I might be biased. I'm always biased towards Turkey. It was a great experience. Even now, it's very interesting. So now I'm in the committee for the selection committee, and even tell the people who are applying medical school in US, I'm encouraging them to go to Turkey and do it.
Great. This is exactly the same thing we're doing here.
So, probably it was a great experience in a way that I think being student is a different stage of your life. And I miss the social aspect the most, probably, how you interact with the entire universe as a student when you don't have any resources, you don't have money, you don't have career, nothing, but you have yourself. And it's in Turkey, it was still, possible to enjoy life, really collaborate, travel, and all kind. I think this is also true for Europe. I think the medical education and medical students associations and all things like student conferences in entire Europe, including Turkey, it was really fun. So one day you can go to Egypt and you can do some research. You can really have really nice social life in your city that you can afford in the same time. And it's welcomed. And in Kocaeli particularly, that was really a nice city that was designed for it. And as a student, we called like the city of students, that you had from ice skating to skiing to, seaside cafes to everything. And as a student, so it's really, you don't ask for more. So probably and then in the same time, you can focus on your education, but you don't miss the life. I feel like here, we are kind of missing the life, and for now it's fine. So we are working very hard. We don't have time anyways for some reason, but as a student you want to expose to multiple parts of life. So I was doing, for example, car racing when I was in Kocaeli. That was possible. And in here, when I look at the medical students, it's so focused. You already have $300,000-$400,000 debt. You know that it's going to be on your shoulders for you later. So this kind of things that you start to worry about life, it starts early here versus in Turkey. You're a little bit more reckless, which gives you the freedom to learn more and expose more and do more, I think.
Wow, I wish I knew we could do all those things while I was a medical student. I guess
that was
one of the people who was just stuck in the library all the time with other friends, and the competition was who could sit on the chair the longest in front of the book, and the winner was the one who stayed the longest. And I guess I'm here because I won more often than others. So, but truly, I think, I completely agree with what Furkan said. I think the thing that I miss most is the sense of community that you had as a student. I think the friends that I made while in Turkey, and thankfully the technology is advanced that all of them are just a few clicks away. You send a WhatsApp message and you have a childbirth and you celebrate with your friends, and that bond that we created, that's lifelong. And I guess you would create that wherever you are in medical school, but I think it was a very special place and a very special group of people that I created that bond with, the most polite, the most thoughtful people, the most selfless people. Anytime I needed help in Turkey when I was there, after I've left Turkey, and I just had to say, or maybe not even say, they could just read it on my face and they would know that I needed something, and they would offer and go above and beyond. So the warmth of the hospitality that was there amongst my Turkish friends, like, my friends would fight over who I would visit on Bayram, right? So who I would stay with, because I was a student, I didn't have a family there. I was going back to India, or my parents were in the Middle East then, so whichever. And so those are really the amazing things that I miss about Turkey. The education was amazing. I don't think I can add anything to what Furkan has said, and I think we'll have a chance to talk about it later. And the other thing that I miss is the food. And Dr. Zeliha knows that. She knows my passion about Turkish food. We meet up often, and it's always we have to have something planned for food when we meet. So yeah, it's an amazing place. I think for those of you, and because I mentor Turkish students, I hear frustrations about the medical education there and the life there. And take it for somebody who's been years out and has seen a lot of people from other places. There's much to be thankful about. Yes, be passionate about changing things. Don't settle for things the way they are, but still be thankful for the things that are there, that are really good, that are excellent.
Exactly. Thanks so much. Dr. Ernest, you were a medical student here. How was it in
Yes.
US?
So I went to Howard University Hospital for my medical school training, and I'm born and raised in Washington, D.C. So for myself, I really wanted a school that would be representative of what I wanted to do for my future. And so that's been the emphasis for me. But I have to agree that the medical education, which is part of what we're hoping to do with our docuseries, is learn how medical education is performed in other countries, so that at least students here could have a glimpse of it. Not knowing that it can be any different is, I think, the biggest struggle here in academic medicine and training of medical students. And there's a certain sense of almost, it's like factory work. You're just popping out as many medical students as well trained as they can, and you meet the rankings and all those other criteria. But there's criticisms for it. There's positives, of course. I think there's tremendous opportunity, particularly for research here, which is phenomenal. But you have to take initiative. I would say the one thing here in the United States is just don't follow along with what everyone else is doing. Find those things that you really sound a chord for yourself, and be all in. Do as much as you can to develop yourself, because you're not going to be spoon-fed. You're going to have to do the hard work.
Thank you so much. So I want to turn again to Zishan and Furkan. And as a university-affiliated physicians, what are the pros and cons for working in the US? But you also shared some insights on the research landscape of US.
Furkan, I'll let you go first.
Okay. So, I think it's a complicated question in a way. I think there's really kind of summarized in a really nice way. Like you're never like spoon fed. So you have to take initiatives, and you need to know what you really want. Because I think if there's one really big advantage in US, if you know what you really want to do, then it's open for you. So you still have to fight. There's still lots of challenges, but you can create and do it in your way in US, which is probably a little bit like unique advantage, or the positive thing in US. So from that perspective, in like medicine residency, that again, we had like 9 months that I could create according to what I want to do, which invested there. And then after graduating from all these trainings, when you say things that the people normally do not do, so there's an opportunity to do that. So normally it's not easy to, you know, have a lab, go to a clinical trial, then come see patients, then go see medicine patients, do, you know, manage the codes in the same time. So this is like, it's hard to kind of even imagine. But in here, they, if you want, they give you the tools to do it, and then they support you if you can get it. So you still have your own funding. If you don't have your funding, you cannot do this. Nobody's just giving you the money to just do whatever you want. But the platform is here. When you want to do it, the incredible, you know, dedicated trainees around you, so that because you're alone, you're nothing alone. So you can create a team that can support your goals as well. And then you can work together, shoulder to shoulder, to be able to do this. Otherwise, it is impossible to do this alone. So you have to rely on people, teach and learn in the same time, and then grow together. I think this environment really allows that to collaborate from multiple aspects of biomedical world, not just, you know, doctors and scientists, so that everybody can teach you something, your trainees and everything, and you can create the system that works if you really want. I think this is the unique aspect that I can say. It's the flexibility of doing things that you really want to do.
Yeah, those are some great thoughts. I think the unique thing about being an academic physician, especially in, you know, in centers like where Furkan is and where we are, with amazing biomedical research going on, but also amazing educators, you always feel that you have the opportunity and option to do something new, something different that hasn't been done before, and create a path. And in doing so, you may not find the person exactly doing what you do to gain that expertise, but you will find the different pieces you need to put together to make the foundation for where you go. For example, so unlike Furkan, and I think this is something what I would emphasize to anybody who's seriously thinking of pursuing a research career. When I started, I was asked, and I finished 3 years of residency training, during which I got a master's level degree in clinical research methodology. And internal medicine residency is hard. To get a master's during that was extremely hard. And so and it was because I was interested in research, and that was a career path I would take. And so when I started, I was asked by my division director, how much time you want to spend doing research and how much time do you want to be clinical? I was like, okay, there are two things that I enjoy, let's say half and half, but that's not how it works. And, you know, you have to be, if you are going to be a researcher, and that's something he said to me back then, I see that in Furkan's career path, I've seen that in other people's career path, research has to take up a bigger chunk of what you do, because it requires gaining a lot of expertise, a lot of time, and a lot of effort to put through some new knowledge, new data, new way of doing things forth. I would say I buck the rule in the sense that I've never been 80% research, and I'm fairly satisfied with my research career. And that sort of comes back to the idea of building a path that's your own, that's very uniquely possible, encouraged here in the health system and the education system that is in the US. So I started off as a patient experience researcher. It was a new metric for measuring how hospitals worked, patient-centered care. And nobody had done any foundational work on that. It literally was coming out the time I was coming out of the residency, and nobody was doing that at Hopkins. And I sort of did some of the foundational studies that were in NPR and the national news, and created some. And then I realized I was a program builder who would want to build programs around the new science that I was creating. And I saw have a leadership path that was related to that. And so I never transitioned to seeking external funding and being an 80% funded researcher, but I never gave up what was on my DNA to continue doing research. And as COVID hit, because of both my leadership background, my leadership aspirations and roles, I was tapped to be the chief medical officer of a fairly busy medical center that took care of COVID patients for 3 years. I think for a year, everybody knew we were there. For the remaining 2 years, I think most people didn't know we were there. But there I built a team that did a number of different researches. We were actually published one of the largest studies on how accurate rapid antigens are when there was just no data. And we continued doing multiple other research similarly. It was the basic building block of how research is conducted. I knew that, and there was an opportunity, and there was a question that needed to be asked. And just because of where we were, what the timing was, again, those were things that were in the national news. And so while I would not necessarily encourage the path that I've taken in the sense that there needs to be some fortune and some support to take that path, it is a possibility, and a lot of people could be successful if they knew that. But to be a successful researcher, I think it's the things that I would encourage people is, understanding what research is. Everybody has a notion of what research is. But I think it's a lot more broader than what people think. I think they've seen one or two different types of research, and that excites them. But again, the question was, the life in USA and the research landscape, it's broad. You can study a number of different things. You have a lot of opportunities. You start a path, and then you figure out that the question you need to ask is sort of going in a different direction, and there's support and a system that understands that encourages that, but it's a lot of work. And the other thing that I would sort of echo what Furkan said was, alone you're not successful. You have to start being part of a team, and then start building team around your idea. And when you're part of a team, you're around somebody else's idea, and then you sort of try and go out of somebody else's orbit to create a focus where there are others in your orbit. And all of those things happen often. Just requires a lot of work and a lot of focus. There are days that people feel that it will not happen, but it ends up, you keep working, you keep striving, and it works out.
Thank you so much. These are great. And while you are a medical student building your career, you have to think about the healthcare system as well. So the research is very important. Clinical services were very important, but the healthcare system is very important too. Then I want to turn back to Dr. Ernst. You're a self-employed physician in the US, and you will compare healthcare systems. Can you share your ideas? And you make a very different service. Could you mention us about the service you provide and why did you choose it?
Yeah, so I'm fully independent. I serve the interests of my patients, and I do this in the capacity of, I'm kind of untethered. First, I can go anywhere at any time, and that means that I actually see the environment in which the patient is living, and I can start to identify things that I would never see in clinic. I've had plenty of my diabetic patients who I go in the home and look in the refrigerator, and there's the ice cream, and guess what? Medication hasn't been compliant with, and a whole bunch of other things. But I am kind of like a cheat code because I work with other professionals in collaboration. Johns Hopkins is very significant for that. Here in Washington, D.C., we have a satellite hospital, Sibley Hospital in Suburban. I also work with Mayo and Cleveland and others. I am kind of the intermediary, but a collaborator, because navigating the healthcare system here, as you discussed, is very challenging. If without a Sherpa or a guide, it's very easy for patients to kind of miss the mark on representing themselves. And in a sense, I'm an advocate for them. But I also come with that background, research background, but also as a family physician, a sense of how to collaborate with my colleagues in the right way. There have been plenty of times I actually will take my patient and go to the specialist. So we just went to Cleveland, and I would be there with the patient and my colleagues there at Cleveland, and we would just walk through it. And quite honestly, if I hadn't been there, there would have been information that was vital for the case that was missing. And so it's a kind of a reorientation. So I can only do what I do independently. I'm not tethered to any particular institute, but NIH is also another one that's here, and I have helped to move patients in that direction as well. And in that regard, since I'm not in the healthcare system, I am entirely private pay. So if you were to think of what my position would be like, I'm almost like kind of hiring a lawyer. Not a great example, but it is a matter of what is the value of the service that's provided. And I think over the 15 years that I've been doing this, It's very clear. This is not something that you can, put into a package and sell. This is, I'm on call 7 days a week. And if I have to go out, I'll go out. But I enjoy it because every opportunity, especially even when I go to see my colleagues, I'm always getting a refresher from medical school because I work with some of the best. And, I'm getting kind of a cheat code into all of the, I can read plenty of articles, but it's nothing like going to a colleague and saying, hey, what about this? Or, here's a case. What do we do with this? And I get very complex cases, and it does require walking through it. And I would say the value to the families, not just the patient, to know that they have a resource, it's gold. And that's why I continue to do it. And more importantly, it's why I'm trying to pass the baton on. So for myself, I'm getting older. Starting the nonprofit is solely to be able to pass the baton on to the next generation. And telling those stories is one of the ways for us to be able to bring everybody together, to bring patients, to bring communities, bring families with those who have the potential to care for them. So the stories that we have, we are developing one for sickle cell, and I'll put in the comments section links to those so that people can take a look. But it's, I'm very eager to collaborate, to listen, to experience things, because there's always this sense, a researcher is somebody who has curiosity, right? There's tons of curiosity out there every day. Every case that comes in, you never know what it's going to be. So yeah, from my perspective, being an independent in the healthcare system has worked for me. It does mean you have to take initiative. You don't just sit back. Nobody's going to walk into the clinic. I'm literally out around the city, and I always wear my blue scrubs everywhere I go. You've seen it, and so it's a very interesting experience. Maybe not for everybody, but certainly it's the right one for me. And I'll put some links in the chat section too.
Okay, thank you. We will share that. It's really interesting. And when I heard it first, it was very interesting for me. Now I got used to it, but I want to share it with my students as well.
Many times when I have my colleagues, they're always, and they don't know me, they're usually, what are you doing here? And then afterwards, after I get a call and said, thank you for coming, that was very helpful, and let's continue to work together. So
thank you. So you made a visit to Turkey recently. How was your visit, and how did you find the environment? And did you get an opportunity to compare the healthcare systems while you were there? Because we have an excellent healthcare system in Turkey and excellent insurance system in Turkey, but you have an opportunity to compare it with US?
Yes, I did. And I came back from that experience angry because, well, I'll explain it that my mom being from Istanbul, I wanted to go back and kind of retrace her steps, the neighborhood in which she grew up and, where she went to school. And forming some connections there, I had an opportunity to go to one of the local hospitals. And I said, I really wanted to just, without barging in, and, I wanted to absorb kind of the experience. And just sitting down for dinner, talking about this, and one of my friends said, okay, well, I have a physician I'd like you to meet, and we'll meet them tomorrow. And we just, the next morning, set out, went to the clinic, but it was just a kind of like an area where they could sit down and, the patient came into the lounge. It was an elderly woman. And the physician, a young physician, very charismatic, came out, smiled, and, went off in Turkish, which I speak no Turkish, so I just sat back and watched. But you could see the facial expressions and you could see the connection that they had, and it was very robust and therapeutic. And they actually had tea, which I've never seen a doctor here do that. And then, and then they took her back, and she had radiation treatment for her breast cancer. And it was all, what could be a very sterile, very clinical environment was more humanistic, and you could just see it. And coming from that experience back to the United States, I'm not saying that we all have to drink tea with our patients, but there's a certain sense of the humanistic side. I always have this gold standard, which is, is this how you would treat your brother, your sister, your mother, your father? And if it is, then I trust that you understand what the patient is going through. And I always take that from that perspective. But also, the system that I was able to observe briefly, here in the US, if I needed to get a record for a patient, first of all, I need to get it released and I fax it in. I know 48 hours I may get it later unless I'm in an emergency room. I just had, my friend just said, oh yeah, I can see everything right here on our app, all my labs, everything, any question, no interference, no, it was really surprising how easy it was for the patient to engage with their own health if they had a question, and then go from there, where, it's almost like there's a distance created, and part of that is we have a duty to educate patients, to bring them into the fold, because for a patient to be engaged is the most significant thing in their own care. Like my diabetic patients who would still eat their ice cream, they're not engaged. So how are you going to turn it around? And I was just, fascinated, and this was just really on the surface. So the next visit, which I'm hoping we can do, is to look at the history of medicine, but also the education in Turkey, and then really getting out, doing house calls in Turkey to really see and feel it. I think that's the most important part. And the end point is to really be able to bring that back to the US to, affect change, to give a different perspective, not to say one is better, but just to give a different perspective on things. Exactly. It's very inspiring to me.
Thanks so much. Dr. Zishan, Dr. Furkan, how do you compare the healthcare system? So you know a lot about healthcare system of Turkey and US. How do you compare it?
Zishan, this one you have to start.
I'll go first, but as you know, it's been more than 20 years since I've left Turkey, and there's been remarkable change in the Turkish medical system since I've left. And my interaction are more with the education side of things and not the clinical care. So I may not be the best placed person to compare, but the observation that I have, is just, and I think those are maybe still valid, is I work in an inner city hospital. And so part of being in the inner city hospital is that you take care of a lot of underserved, uninsured patients who are, and insurance is not the only thing they lack, right? They lack a lot of other resources in their life. They have housing instability, and because of that, whatever else they lead to, they live in a high crime area, and they themselves get involved in that crime, either as victims or sometimes as perpetrators. And that is a very different population than any hospital the hospital that I worked in was also in not the fanciest part of the city. It was a public hospital where all comers would come, patients with less education, not as medically savvy as, the more educated people would go to the more private hospital. But there's still that stark difference in that population that you see. And so it has this unique challenge between the differences between the two health systems, where there's this amazing capability, but there's also this population that is so amazingly deprived. And sometimes you can be engulfed by a sense of futility because you take care of somebody, but it's not the medical care or the medication that you give to them is going to fix what they do. I had a patient who came in just this past week, drunk, but a lot of medical problems. And as soon as, their intoxication was dealt over and we took care of one or two things that was bothering, they against my wish, they went back into that system there, and lived that life. And my note says, I don't know if I fixed anything. They're going to be back, and it's going to be the same problem. We could have done better. And so that's one of the comparisons that that stand out to me. But then also there's this, and I'm just picking some individual, I think, memories and comparing them. One of my very vivid and maybe most vivid medical experience was when I was an ED intern in Turkey, and we had a patient who came in with a self-inflicted gunshot wound who had shot here, who had an argument with his wife, was a young guy. And so we were in the medical bay, and there's a whole team was in there trying to do things. And I was like, what is my role here? And two of us were holding down one of his hands. And I was like, maybe it doesn't require two people, and I would let go. And that was not enough. And I was holding down. So that was my role. But it was the intensity of the situation where the system where, the family members just put them in the car, brought him in, and we were palpably very close to what was happening in the family. The two families had a conflict, right, because of the reasons of why, and it was right there in the ER that we felt. And in the US, I think, patients would most often come by EMS, and so whatever the outside situation was stayed outside, and you were sort of medically isolated from that. And so I think those are sort of the two very vividly different experiences that I recall about providing care in Turkey and about providing care here in US.
Yeah, thank you. Furkan, what do you want to say?
Yeah, I think, I mean, I'll put in a perspective. So with the word accessibility, I think, it's a very two different system. Like in US, it's a main problem that accessibility is so poor to really access to care that is really something, and everybody knows this. So if they can access, let's say, I mean, I'm providing the care. If they have access to my care, I provide, a great care. So, or the hospital systems, policies, everything, the quality of care, the bar standards are so high that if you can get there, you will get a great care. And they're really, all these codes of being physician and everything can be implemented in a highest level. So the hospital is very proud of, but in the system, there are huge amount of people stay out that cannot reach to me. Or, waiting time is, really, I mean, getting closer to 1 year, especially after COVID, it's really shuffled. There's lots of shortages. So we don't give up from the quality of service, but that's, in a system wise, it doesn't work. It's just people do not have a great access when they need it. So this is a big problem of US, that the accessibility is a huge issue, timely seeing the right people to get the care to initiate. Once they get it, the care is great. And the time you spend with the patients is optimal and everything. So in Turkey, as a health system, accessibility is not an issue at all. So it's too much accessibility is the problem in Turkey. So with the universal health coverage system, when it transformed everything. It was like incredible reform in Turkey, really happened early on. And that was a huge gain. And it was in Harvard, Harvard School of Public Health, it was a semester lesson. It was the Minister of Health came and gave the lesson how we can do this. It was exemplary, for the rest of the world, how we can really change the system that make it accessible and help the people without really worry about the cost, without really worry about anything. Am I going to have access to, the economics or medications or doctors or anything? So that was a big revolution, I would call it. But to keep that system efficient, there were some codes that they couldn't keep up, and it became in a way that it became too accessible, and then it was too much exposure for things that the triage lost. So that you can see the specialist right away for, if you have runny nose, you see the ENT specialist who is doing very specialized thing, but someone who need that specialist for 1 hour cannot get that 1 hour because the number of patients that being seen is too much. The providers are exhausted because the number of people seen, they have very limited time with the patients that really decrease the value that they can provide, which creates the satisfaction because as a physician, you want to spend time, you want to create relationship. There are really different roles a physician have. So that is kind of getting lost, which I think is a very biggest danger in Turkey now that is stressing the system is too much accessibility. And people would, think about the accessibility is great, but it needs to reshuffle and there has to be sweet spot in between US and Turkey, how you can keep optimal time with the patient one-to-one and really deliver your excellent care because we have great doctors. They want to deliver the best. But if you have just 5 minutes with the patient, you cannot deliver that. There's no way. I mean, they're already acting in a heroic way that I'm really impressed, all of my colleagues in Turkey. But from a patient perspective, they love being, just able to see everyone the next week, the next day. So I'm not expert, so it's easy to criticize how you can find the sweet spot. I think Turkey had a huge gains that I feel like need a little bit reshape again, with taking some political risk if it's necessary to really keep that exemplary thing that this universal health coverage. Here, people worry about the cost. People worry about, can I afford this? Can I get this doctor? In Turkey, there's no such a thing, which is extremely valuable. But I think it can still be optimized in a way that the system can, in the same time, would not give up from the quality of care rather than the quantity of care that they deliver. But that's my observation. Again, I'm also out of Turkey since 14 years now. I might be also seeing a little superficially. I don't want to claim the expertise on that. I'm not an expert of health system as well, but this is what I feel and sense when I talk with my colleagues, when I talk with the patients, when my family goes to the system. So that's what I feel like.
Thank you very much for your sharing, for your thoughts with us. And when I went from our medical students to make realistic plans for their career path. So there is no utopia. There is no shining country for everything. So some countries have really positive things about research. Some countries can have good healthcare systems in Europe, in Turkey, in America, and other countries of the world, but they have to make realistic plans. So with all pros and cons, right? So, and I want to get your advices about our medical students for their career path. For those whoever wants to continue their medical education or make research in US, can we start with Dr. Zishan to get your advices, please?
Absolutely. So that's a topic that's close to my heart because I do, and actually had very recently, even just this past week, a student visiting from Turkey who's trying to make that transition. And I would sort of put things in a few different buckets, but the main thing would be readiness to go into a system where your preparedness for that system may be different than your preparedness within your system. And the transition that I'm saying is you're a medical student and you're going to be an assistant or a resident in Turkey, and the readiness that you need to be a resident in Turkey may be different and is different than what you need to be in the US. And when I talk about these with students, I put it in a few different buckets. One is your readiness to start applying the clinical knowledge you've gained in patient care on the day one of your residency. I think that is one of the biggest differences that I've noticed, and it hasn't quite changed in my discussions with all the students that I've met with, and there's a whole idea of transition towards that happens during medical school, and then again more seriously when you're a resident, and I think that is something one needs to be mindful of and figure out what are those key differences, and what, while you're in medical school in Turkey, what can you do to prepare yourself? One of the things that I'm describing it in a sentence and it'll take a minute or so, but if you can visit here, right? So we talk about observership, hands-on experience, you'll know what I'm talking about. And then you can prepare for it. And when students visit, we have students at Hopkins that come from Bezmi Alan, besides being ready to be the physician who's taking care of the patient, right? So they're in the third and fourth year, students are embedded in the system, the patients are assigned, and they're in the medical team. The experience with the patient is not like anatomy lab where you have a little bit of experience with the cadaver to learn what's in the book. You're actually the doctor who's maybe gaining something back from the book to take care of the patient, and not the other way around. And so to be prepared for that experience, I think, is something really important, and to think about, and that's the first few months, first few weeks that you do here are going to be important in how you launch your career. If you come in and feel incompetent when you're not, but because you've just not prepared yourself for that, then it can have a downhill or a ripple effect in what you choose down the stream. And then there are other sort of things that are a little different about this health system that are from Turkey. For example, how we understand and expect professionalism. What are the standards of communication? And just something as simple as electronic medical record system, which most of the medical students in Turkey, as they're going through education, are not quite provided to access to, but it is, I think, an integral part of education because it's a system that you're going to use. It helps you and it hurts you, and you have to start learning how it helps you and how it hurts you, just the way you're learning how your drugs, your diagnostic process, and everything else helps and hurts the patients. And so that's sort of the bucket that I would put in. And then, in terms of the question about a research career in the US, I think what I mentioned earlier is to take a step back and say, what is truly research, right? Is it a lab research? Is it these drug research? And truly, research is much broader than that. I'll give an example of an individual who I think of as a mentor figure, Peter Pronovost, who was, Time Magazine's 100 most influential person for several years running. His claim to fame, well, he's done many things, but people know him for one thing, is creating a checklist that virtually eliminated central line infections. And the idea that was that there are certain, when we put a central line for those, for medical students I'm talking to, it's a thick catheter that goes into the vein. And because it's placed in patients who are very sick, and it breaks the natural barriers between outside world to the inside world, it was taken for granted a number of individuals will get infection, and those individuals then died or had a lot of other bad complications. But he said, well, why do we accept it to be so? What is the whole science of everything that we know that can prevent it, and how can we make sure that we use it every time? And he learned we didn't know for sure what it was, and we were certainly not using it. Everybody was doing it the way they were. So he created a whole checklist of things that had to happen every time we did it. And this disease this eliminated from the hospitals. Like the numbers from 10 in 1,000 or 100 in 1,000 went down to 1 in 1,000 patients who would get it. And it was estimated that this change was saved more lives during that period than any new drug that was discovered or a new surgical technique. And so I'm talking about a process that he created, but he studied it to show those numbers. And so this is not your research of a bench scientist. This is not your research of a clinician. This is a quality improvement research. And I do patient-centered care research, where it's about how patients perceive communication. And the idea being that if the communication and the quality of care they perceive is not poor, they may not be as engaged with their care, something that Dr. Brown's talked about. And it would have downstream consequences in how they seek care and how their cares eventually their healthcare outcome. And so this is, again, not a classic research. So more so, I would say take a step back for people to understand what research is, and then figure out what inspires you. Often it's going to be a mentor figure that you work with who's doing some research that is great, and you tag along. The other is training. I think if you are serious about research, training is unglamorous. After 6 years of medical education, 3 years of residency, 5 years of residency, 2 years of fellowship, you still need to get more serious research-oriented training. That is the only path to success. And for most people, it is, I think, is taking the path what Dr. Burak is taking, which is dedicating a lot more time in research. I do think, and I do see a lot of examples of people who do what I do, in being not 100% research focused, having passion for leadership, having passion for education, but carving out a niche in research. And it gives me joy to add to the science of medicine and doing and answering some critical questions and fundamental questions. It's a trickier path, but it's a path that others have taken to. So that's broadly what I would say for people who are interested in research.
Thank you so much. These are so valuable. And what do you want to say, Furkan?
Yeah, I think, if I think about, and probably we are talking to people who went through my path. So they're a student in Turkey. They want to come out of, they want to kind of pursue some different careers, or being physician scientists, or different aspects of medicine in abroad, and how they should think about. I think it's the first, you have to be honest to yourself and find out what you really enjoy. Are you like really enjoy fully being clinical? Like, this is like a passion. I mean, I allow seeing patients as one-to-one interaction. It's invaluable. I really like it. So you don't have to, because in Turkey, you go to your medical school by ranking. It's not by you tell that this is your passion and you get into medical school. That's the one difference. So you don't even know that actually your passion is medicine until some part of the medical school. And we all know during the medical school, some of our friends figure out this is not a life for them. So that you have to understand, do you really enjoy research? You really enjoy health policies, health economics, different things, interacting with people, more surgical aspects of things or more research. So you have to know which one you really like, that because you're going to really spend lots of resources, and your time is the biggest resource to really get that. And then the second, then to be able to do this, you cannot go with the flow. In Turkish system, if you go with the flow, it's known. So, and you will get distress each time you want to do something different. And everybody will tell you most of the negative things, that you have to know that not listening to people who tell you what you cannot do. This is important. And then really separate yourself from the crowd and say, no, I want to do this. And I mean, also statistically, or any kind of aspect, that the people who get into the medical school in Turkey, I mean, to me, they can do all. Like, they can conquer the world. This is like super talented, incredible individuals that needs guidance and to shape how you can actually pursue. And then when they, let's say, switch to here, so the first difference, like skewed, like the silence is gold in Turkey, but it's not gold here. So if you come here and being silent in the round, so you will lose it. People will think you're not interested in, people think you're not happy, you're not really excited. So it means you will lose everything. Versus in Turkey, if you speak up, you're gonna kind of get punished. So it's a cultural difference, which is very natural. But when you think about it, first, you should not hesitate to do mistakes. Without doing mistakes, nobody can do anything. If we do another session, what kind of mistakes I did towards all this 14 years, I can write a book, and probably, people would stop what I'm doing. So it's nobody comes from sky. You have to know that you have to do mistakes. Don't hesitate, ask questions, and be active, and really don't hesitate to speak up, which almost like all of the students that come from Turkey, and that's the biggest and first mistake they do. They hesitate, and they go to the back, and they don't speak up, they don't ask questions, and that silence is not well received here, which can be very negative. But I know them personally. I mean, they're incredibly bright, talented individuals. The idea is even better than me. When I ask them, when they speak up, their idea is better than what I would do for that patient. So they have to know this, and they really work on this to be able to kind of seek the work, and then do mistake, whatever, but just pursue it. I think that's what I would say to start with. And then you kind of see it, the different aspect of when you expose, and that's how you see, is this the right thing for me or not? And then you should be able to adapt. Like you have to be resilient. It's not standard. You can have some failures. You will have some failures. You have to accept that. And then you need to know how to navigate back, try to find the right path for you. That's the only way to be really successful and enjoy. We all want to enjoy our lives. We don't necessarily need a glorious careers. We really want to enjoy the life. You really enjoy when you do the things that you really like. But that's a process you have to accept. You have to spend time. You have to work very, very hard. Be confident, but in the same time, you have to work hard. You have to sacrifice lots of things. It doesn't come right to you. As Dr. Ernst said, like you have to really spend time and effort and all kind of things, and lots of sacrifices comes with it. You have to accept the fact it's going to take time. It's not going to be one exam that you're going to be at the top and you get what you want. It doesn't work that way here. You have to create this. You have to draw the picture to show the people to get it, which requires lots of elements, not just being successful in an exam. It's just a checkbox here. So these are the differences that they have to know and prepare themselves. Can I do this, or do I want to do this? And then really pursue without really listening much about the negativity.
Yeah, I just want to quickly add on something to what Dr. Furkan said. I mean, 2 points that he made, and I just want to reemphasize that. One is understanding what your passion is. And if you've not spent a life, in your middle school or high school, when you're making that choice of going into medical school, to ask and understand and what your passion is, it's not easy. And so it's a learning process of knowing passion is not this crazy idea that keeps you up and drives you. It's actually always, it's under the I guess surface many of the times, but it's your driving force, and it's a very gentle driving force and not a crazy wind all the time. And so I think to understand what passion is, I think it requires one to know oneself and understand which driving force is truly a passion. And it comes from a lifelong experience of understanding oneself and one's drivers. And so that's going to be a unique experience for many people who are going to try and do that. And the idea of speaking up, again, I couldn't agree more with that. It's not so much speaking more, but it's being confident in your ideas and letting them go out in the world and being vulnerable, that they may be shot down. And I have learned that from friends who allow that vulnerability, they've grown more. Absolutely. Absolutely. And vulnerability is not necessarily, and actually often leads other people to, if you show your vulnerability in learning, I've seen more often people willing to teach you rather than undermine what you know and show you as somebody who doesn't. And so I think it's still not going to come easy for people who have not experienced that, but those are sort of the foundational learning things that I have learned. And I think, those are just amazing advice from Furkan. I really appreciate that.
Yeah, great. So nothing comes without a price, you're saying that. So the learning process of different ecosystem, different culture, and the interaction with other people within the hospital and within research ecosystem. So they have to prepare themselves for that too. It's not just taking some USMLE grades and just coming here and showing up. It's not like that. So there's a learning process for each, like the economic system, the healthcare system, the social relations, so the communication with each other. So every country has its own social ecosystem. This is the most important thing, I guess, the communication styles and the social ecosystem. They have to prepare themselves for that too, because whenever they come here, sometimes they just burn out within a year because they were not prepared for coming and working here in US. So the system is totally different. So it's so helpful back in Turkey, but here you are isolated and you are on your own. You have to know exactly what you want to do so that you can plan and go for it. Dr. Ernest, can we get your advices for our medical students who are planning their career path in US? Or just, you will say that go and just stay in Turkey or just see here, but make connections and go back.
Yeah. I think one of the most important things to consider as a young medical student is never be comfortable. There's a certain sense of curiosity, but what is a killer sometimes is you just lose an edge. You lose the ability to, if you only want to be comfortable all of the time, you're not going to grow. So you must take the risks. Even when I was a medical student and we were doing our rounds, I would sneak after doing rounds and after being in the hospital all day, I'd sneak to the patient's home and check on them because one of them lived right down the block. And I was reprimanded by my attending not to do that. So then I just did it more covertly. But I got so much more out of it because then that patient didn't come back to the hospital for the entire time that I was there as a medical student and further on in residency. And I still kept in touch with the family. They did pass. But if I didn't take a risk, I wouldn't have seen things. And, people, everyone here is going to have their own unique life experience. But if you're only narrowing your vision to it, you have to also think about your longevity as a physician. What are you going to be when you're older in whatever healthcare is? We are in the middle, right? All three of us, all four of us, all other. But then, with the young ones who are coming, there's a certain obligation to tell them our stories, which is why we're doing the docuseries, but also to give them curiosity, but also a force to be able to take the risks. And I think if you don't, you will find yourself in a place that you probably wouldn't be as enjoying. I wake up every day excited, sometimes confused, but excited about what's going to come. But for me, this is magical in a sense. And it's infectious because I've been infected by the experience. And I would hope that others out there would just, come to the US. I mean, go to Europe, go to other places, and especially if you have a special interest, something that really is like solid, that it's like musical, it like hits the right chord in you, run with it, because that is uniquely your own, and that will be the uniqueness of yourself as a physician, not just as a career, but as a physician for the rest of your life. And the other part of it, I would say, is it's legacy, right? We have predecessors before us. We stand on the shoulders of giants. Well, who's going to be the next giants? It's not going to be the people who are comfortable and didn't take risks.
Exactly. Thank you so much. It is wonderful and fruitful meeting for all of us. So maybe there will be some questions from the audience. We have one about the research, but you already responded it. So, okay, so we are exactly on time, but still, if anybody wants to ask any questions, please write to chat box or just ask directly. Zeynep Şimşek, right? Okay, so you can ask your question. Go ahead. We cannot hear you, Zeynep. Your voice is open, but we cannot hear you. Do you have a micro? Okay, you can write to chat box if you want. Okay. So I have been in UK, in Netherlands, in Germany, in Italy, in I saw many hospitals, and I saw that each country has its beautiful stuff, but some risks inside it. So you have to prepare yourself, as we already talked about it. But when I see young generation, they want to just capture everything fast, and they think they can make it easily. Nothing comes without a price, as we said already. So they have to work on it, and they may be visiting our countries when they're already students and seeing the environment, if it's good for them or not, would be helpful, because people travel a lot anymore. It's not like 90s. Our medical students are from other countries as well. They go everywhere nowadays. So they want to see what is good for themselves and to see everybody. So there's this question already, but they have to be ready. So they have many sources to get in touch with the culture, with the social system, with the healthcare system, with the research system, and with funding, etc. So that they can see and they can decide whenever they interact more. So Zeynep Şimşek, postdoc researcher at Duke University. Nice to meet you all. Thank you for this great meeting. Thank you for coming. My question will be about essential advice and recommendations from your personal experiences, because I think this could be helpful for those who plan to apply residency programs in the US. Is there anything you wish you would have known before applying for residency? Or if you go back now, is there anything you would do differently or try to do better while applying for residency or during residency years? For example, you do more observerships or publish research studies. Who wants to take this question?
But I can start and kind of reiterate, like, I did not apply residency right away. So I think being in the system professionally before the residency helped me a lot. So to really how you can manage conflicts, how you can interact with your colleagues differently. You're coming from a different culture. So you learn more before you're really in the role of the front field. It's being in the front field. You have to know how to fight, if this is the right word. So I think when people apply, they just want to get in right away next year after medical school. So you have to prepare yourself professionally, because being student versus being professional is extremely different, and you have to prepare for it. And doing something else, or doing in between, exposing more in a different roles, prepare you better. So moving forward, the transition or the journey is more smooth, versus when you jump in without learning how to swim very well, then it's first you can be drowned, or you're gonna struggle a lot. So I think there's no rush to get into the residency right away. I know there are some gap years is the problem, but rather than gap year, preparing yourself professionally to residency, I think from a personal perspective is really valuable.
Yeah, I mean, I think, you know, if you spend some time here locally in some capacity, it gives you a more wider view of the system and the opportunities, and you're able to express that better when you're talking to people who are going to open the doors for your career path, i.e. your residency program director. So you know, for those people that opportunity is available, I think it's worth taking. It may not be possible for everyone. I think that, you know, the question that you're asking is you should do more resident observerships or publications, and that sort of goes back to the checklist of things that you need to do. It all depends on where you stand and what your resume looks like and what your program director is looking like. So it's really hard to make a general comment. There's the right balance for each of those, and I think you know, whichever side is your passion, if it's research is your passion, you can do more of that to show that passion and to have that career path. Observership, as I mentioned, you know, the value is I can tell you in a few sentences what life is like here, but it doesn't paint a picture until you sort of your first 5 minutes, you'll find 90% of what you understood from that maybe not true until you sort of experience a foreign culture. All of us who've gone to a different country understand that no matter how others describe it, when you experience it, it feels very different. And so I think that's the value of observership is not only you're experiencing a new culture, but you're experiencing a new health system. Personally, for me, I think what I unexpectedly, but now when I look back, of course, it seems obvious, had I wouldn't say struggle, but was more of a battle than I thought it would be, is what I mentioned earlier, being ready to be a doctor on the first day in the way the system expects you to be. Right. So starting to apply clinical knowledge, being the professional, being able to communicate, being familiar with the system. And so the more you can do to be ready on that first day, the more you sort of feel that you're ready to fly, right? So we don't want you to just survive. We want you to thrive. We want you to do amazing. So the more you want to do that, the more you'd sort of feel like you are, you know, you've come from Turkey as some of the brightest, and you would continue to feel that you're amongst some of the brightest. I've seen individuals who, because they struggled in that transition, they cut back on their ambition and felt that certain things they cannot do because they're just not good enough. But actually, they hadn't quite taken the steps that others had because of the system they had come through. So I think that would be sort of my bigger idea that I would want people who are applying for a residency is think about the things that are needed to be a doctor here on the first day of the system. The question, you know, there are a number of things, and you can actually break it down to a checklist if you want, and see where you stand and how much ready you are. It's not going to be entirely the same as somebody who's gone through a medical system here, but you'll bring something new that others who've come through the medical system here will not. You'll ask questions they wouldn't. One of my colleagues who came from Turkey was like, why do we do a head CT scan when every time somebody has a fall, even if they've landed on their knee, right? Because it was a practice that somehow we did here. And so that's my advice for you.
Thanks so much, Ernest.
Yeah, I would say just know that, you know, U.S. is a large country, and, you know, there are you'll find focused areas like Duke versus Boston, get down to Minnesota, San Francisco. There's subtleties and differences within those systems, and, you know, what feels like home for you is important. Because, you know, you're going to be dedicating your life if you're also coming with family, husband, wife, children, and it's the same sort of thing. You also want to understand, you know, you're making the commitment, and if you find the right place for yourself, the right home, then I think I've seen colleagues, Turkish colleagues here struggle in research, and then it was really just endemic to the area in which they were. They didn't, you know, so then they ended up going to the West Coast, and it was so much better in the West Coast. So you just have to figure out what's best apart from that. And there are differences in the programs.
Thank you so much. It was really a fruitful and wonderful meeting. I'm sure that our medical students will enjoy it too when we share our recordings with them too. But I want to add also that please see your opportunities in Turkey as well, because there are a lot of fundings opportunities and for medical students and for residents as well. Sometimes they are not aware of it. So think critically, make your analysis. Where Dr. Furkan shared Kocaeli University's opportunities with us. The geography is so different from Ankara, so the Ankara medical students is totally different, maybe, as Dr. Zishan already told us. You sit more, you study more, maybe the structural medical education is different from university to university, but each university, each environment, each city, and it has its own opportunities. Don't miss them while you are planning your career path, because you're already spending your time there, and there could be some opportunities to join the research teams to get some fundings and build your career in a more realistic and experienced way, so that you can already see other countries' experiences as well. So please think wisely, study a lot, and learn the process and compare the ecosystems and be ready for it, whatever you're planning for. So thank you everybody for joining us today. It's a lovely Sunday in Washington, D.C., but it's Ramadan. Almost iftar time is coming in Turkey. So we are closing now. Again, thank you so much and see you soon, inshallah.
Thank you. Have a nice one.
Thank you so much. Take care.